Good afternoon, everybody. Tess Crawley here, clinical and forensic psychologist and director of Dr. Tess Crawley and associate psychology practice here in Hobart. I'm actually in my little office pod, my little soundproof cone of silence in the practice today, and I thought I would come and touch base with you about a couple of concepts that I really love to talk about when I'm working with clients around perinatal psychology and infant mental health issues. Now, I don't know if you know this, but we have a, sorry, and I'm just sharing while I'm talking, so bear with me while I multitask. Hi, Cara, I can see you there. We have a dedicated division of our practice called, hi Shelley, called Hobart Perinatal Psychology, which is a dedicated part of our psychological practice that focuses specifically on perinatal and infant mental health. Now, perinatal mental health is all about that period of time when typically a mum we're talking about here, but we do see dads as well. The perinatal period is any time between, we use the broadest definition, which is any time from when you're thinking about having a baby all the way through to when your baby starts school. The most conservative definition is around from birth to 12 months, but we have a broader focus. We're very interested in fertility issues, we're interested in pregnancy issues, we're interested in birth issues, we're interested in helping with recovery from perinatal loss and birth trauma and termination of pregnancy, all sorts of things, attachment and bonding with your baby. So we see lots and lots of parents and babies in our practice. So what is infant mental health, I hear you all cry? Well, infant mental health, in the olden days, it was assumed that babies were blank slates and that they didn't really develop a personality until they were much older, and that, they didn't remember what happened when they were a baby, so there wasn't really much that you could do wrong. And obviously we have since learned that this is very much not true. So babies are born with a whole range of characteristics already well established. So there'll be some genetic influences that are already at play within that little bub. So their personality might be influenced by whether or not mum and dad are outgoing personality types. And if they are, then baby's likely to be a bit more outgoing. If mum or dad or both are quite sensitive personalities, well, baby's likely to have sensitive personality structure too. So what we talk about with regards to infant mental health, the most obvious thing we're looking at there is the benefits of a sound attachment. And so we look at how mum and dad and baby are bonding together, what influences are having an impact on that bonding. So was there what we call a premature separation? So sometimes through nobody's fault, but just through the effects of the birth process. If mum has had to have an emergency cesarean and there's some medical care needed for mum, or if there's some medical care needed for baby, then there might be that premature separation between mother and baby. And we try to those of us who have an understanding of infant mental health, including in the maternity hospitals, there's a growing awareness now of these factors. They look at what can be done to minimise the impact on bonding of that separation. So you might have heard a lot about kangaroo care or skin-to-skin contact, and this is where mum and baby spend as much time as they can in those early minutes and hours and days. Skin-to-skin contact. Breastfeeding obviously helps establish an early attachment, but bottle-fed babies can certainly develop really sound attachment with mum and with dad too, through lots of ways of strengthening that bond through skin-to-skin contact and close eye contact and things like that. When babies are born, they research has shown that when a baby is born, they show a preference for the sound of their mother's voice over the voices of other women. They will show a preference for the smell of their mother's breast milk over other breast milk. So babies are pre-wired to love you. So half your battle's already won. unfortunately, they don't come with a manual. So a lot of the work that we do is to help mums and dads build up their confidence in their parenting skills, to recover from any trauma elements associated with pregnancy and birth, to overcome any symptoms of anxiety and depression that might be part of the presenting picture for the mum and the dad. So we draw on a range of our psychological skills to help both mother, father and baby form that neat little, well, I don't know if you can ever describe it as neat, can you, in parenting, but to define that lovely little bubble that exists between parents and a baby. So I've called this blog The Good Enough Mum and Dad. There's this lovely concept that I really like. I'm just still sharing as we go along. Sorry to be breaking my eye contact. There's this really lovely concept that I talk about quite a bit, and I didn't make this up. This is a well-known concept within the perinatal mental health field, about the good enough mother. And I've been talking a little bit with some mums lately about this idea of being a good enough mum. A lot of the parents that I see, especially a lot of the mums that I see, have rather perfectionistic characteristics that have led to quite a degree of anxiety within their parenting, and they may not necessarily trust that they're doing a good job, or they may be fearful that they're failing as a parent, and that you can hear how that might lead to some depression as well. So one of the things I work on with parents is an understanding of this concept of the good enough mum or the good enough dad. And this is where you understand first of all, there is no perfect. There is no perfect way to parent, and there is no perfect baby either. It's really important to understand that your baby is unique, you as a parent are unique, and that you and your baby coming together are creating a unique relationship. So we can't compare apples with oranges when it comes to parenting. We can't compare one good parent against another good parent and decide which one is better. Obviously, we can think of examples of unhealthy parenting or dangerous parenting, when we think of things like neglect, physical abuse, and so on. We're not going to talk about that today. We're talking about, all things being equal, people doing their level best job, trying their hardest for their baby. You're already on the good enough parent radar. Okay, the fact that you are trying your best, the fact that you're trying to learn your baby. So I said before, babies don't come with a manual. Of course they don't. But they do help you write the manual with them. So you and your baby write the manual together. You get to learn each other as you go along. So if you think for a minute about, so in a typical parenting situation where you might have a mum and a dad, you think about how long it took you to get to know each other, and how long it took you to fall in love, and how long it took you to know that you wanted to spend the rest of your lives together. How long did that process take? Did it happen like that? No, it didn't. And yet when a baby arrives on the scene, we have this expectation that there's going to be an instant bond, and that if there's not an instant bond, then we're doing something wrong and we're a bad parent. So a lot of the work that we do around that perinatal and infant mental health work is around helping parents feel established within that relationship with their child, and feeling that they are learning to get to know their baby, learning their baby's cues, learning their baby's signs of need, and responding not just to what baby is doing and saying, but also responding to your own instincts of what you think baby might need. So perinatal mental health and infant mental health, it's such a fulfilling area of work. Most of the clinicians within my team have done some training in this area, and this is not to say that there is a master's program in perinatal and infant mental health, which to date I don't think any of my team members have completed that, but we have been trained by a Melbourne-based psychologist whose area of specific expertise is in perinatal and infant mental health, and she's also in the past supervised me quite closely for a few years around these areas, so that I can then supervise the rest of the team in being great clinicians as they are in the field of perinatal and infant mental health. So if this is an area that interests you, feel free to get in touch if you're keen to work with us in this area, or if it's an area that interests you from the perspective of you're needing some help in this area. Feel free to get in touch. We have quite solid relationships with a number of obstetricians around Hobart, and we've got a growing relationship with obstetricians in Launceston as well. So we're really keen to work alongside you and your care professionals if you're pregnant, or if you're going through fertility treatment, or if you've suffered the loss of a pregnancy or an infant. We certainly are here to help you work through your grief and to build through your grief, your vision of your family beyond that as well, incorporating your grief into that family story. So, the good enough parent. Whenever you're feeling that you're not doing a good job, I want you to remember that the fact that you're worried about whether or not you're doing a good job means that you probably are. Okay. Now, the reason I decided to do this topic today was that yesterday and today I posted two things that were food related to do with my parenting of my children, and the funny irony, of course, was that I had my little kids' hump day breakfast this morning with the fine china and a lovely little brekkie to kickstart our morning. Things still went pear-shaped at the school drop-off this morning. My kids and I, we're as human as your kids and you. So, just take it easy on yourselves. Be kind to yourselves. Hi, Tara. And make sure that you're not giving yourself a hard time, because parenting is a hard enough job without comparing yourself to other people and without believing that you fall short of others, because of course I know that you're doing your level best and you've always got me here cheering you on. So have a great day. Do whatever makes you happy today. Make sure you have some time to yourself. Parenting requires lots and lots of energy, which means it also requires lots of self-care whenever you can find 5 minutes for yourself. I'll talk to you all again tomorrow. Have a lovely day, and don't forget to let me know if you're wanting to participate in our live Q&A sessions next Tuesday. Leave your questions either here or on the pinned post in the Stigma Rebellion, or in my groups for professionals, either the Meeting Room, Psychology Supervisors Australia, or Rural Mental Health Professionals Australia. Take care for today. Bye bye for now.